When given a diagnosis of a condition that may require a colectomy or a colon resection, I know that this can often be very frightful and very challenging for patients. Colon surgery has made some great improvements over the course of the past decades. We now perform colon surgery in a very minimally invasive fashion. We use robotic instruments, which are small incisions and very precise robotic arms that are controlled by the surgeon to complete your surgery. When you have a colon resection, it's very important to understand which portions of the colon are being removed. The colon itself is like a big question mark. You have the beginning of your colon here, where your appendix sits. Your small intestine goes into your colon over here. And then the stool goes in from your head all the way down and then around down here to your anus and out the rectum. When you're having a colon surgery, it all depends on where your condition lies. This is the right part of your colon. The middle, where we call that the transverse part of your colon. This is the left part of your colon, or the descending colon. Down here we have your sigmoid colon. And then down here, this is called your rectum. And that's where the stool comes out. If you're having, example, a right colon resection for a colon cancer, this portion of the colon will get removed. It's also very important that your surgeon removes the blood vessels that go to your colon as well, as there are lymph nodes that sits on that blood vessel, and that's very important for an accurate cancer staging. Next, some of the small intestine is taken and then reconnected up here to the transverse part of your colon. So that way all the food will go safely down from your mouth all the way into your colon. When we create this connection, that is called an anastomosis. Anastomosis is just a basic word for connection of one object in your body to another object in your body, or one lumen to another lumen in your body. So that way, fecal material can go from in to out in the correct direction. When this anastomosis is created, it usually takes about 24 hours for everything to start working if you're starting to have some bowel function. Most patients are in the hospital for about 2 to 3 days after surgery, and sometimes less. But removing portions of the colon actually does not affect your bowel function too much. Some folks may experience it 1 or 2 extra bowel movements per day. They might be slightly looser, but the majority of people do not experience any changes to the bowel function. If you do experience a change in your bowel function, it mostly can be resolved with increasing your fiber content and possibly some anti-diarrheal agents such as Imodium. Other colon resection includes removal of your transverse colon, or your left colon, or your sigmoid colon. When any of these areas are removed, the goal is to take either a portion of the small intestine or a portion of the colon that sits above the area removed and make a new connection for you. All of this can be done in a minimally invasive and very safe fashion, and happy to discuss more of it with you in person.